Good morning. This is Dr. Om Schneider at the Ozark Chiropractic Clinic coming to you a week before Christmas practically. It's the 17th, so Christmas will be here next week. And I want to wish everybody a very Merry Christmas and a Happy New Year. I hope everybody has a safe time with their family and friends wherever they go, whatever they do. Today we're going to talk a little bit about a complaint that I see a fair amount of, and that's called vertigo. Okay, vertigo is the sense of you're spinning, losing control basically. Either your environment is spinning around you or you're spinning in it. So that's a very common thing we see of. And also I see varying degrees of where people have problems with their balance and their equilibrium and their coordination. So I think it's just varying degrees of what we see going on. So we're going to talk a little bit about what's happening in vertigo or what's going on when you're losing your balance. Oftentimes, and one thing I want to share with you too is I've had issues with it too. So when I talk about this, I know what patients are going through because I've had it myself, and it's not a pleasant thing at all. Thanks. So what we do oftentimes is chiropractically, we're going to look at that upper cervical spine. We're going to look at the vertebrae right here, the first and the second. These are very important components as far as dealing with the neurology of affecting your balance, your equilibrium, really through your whole body, because they're affecting the brain stem as it comes into the spine. So there's a lot of control factors that are involved that play a big role in how your body reacts to things there. So that's something we always adjust. I know when I have issues with vertigo, I'll always make sure I get myself adjusted and keep that area working well. And that's helped me a lot also. There's also an exercise we call Epley's maneuver. And I'm going to do my best to see if I can hook a link up to that and give you instructions to show how to do that. It's a exercise where you will lay down, you'll rotate your head, you'll sit and lay in this position for a minute or two, you'll rotate to the other side. But I'll try to give you some instructions how to do that. It's easier than just trying to tell you that way. And this is something you can use at home for that also. But I find that, there's different kinds of vertigo that people have. And like I say, one of the more common ones we see is the people have problems when they get up and down, okay? They can become lightheaded, they can become losing their balance. And so what I want to really stress to patients on this is taking your time, okay? One thing I see people do is we have a habit of just wanting to get up and go, okay? That's normal, we all want to do that. So what I always tell patients is if you got problems with this, you need to go in stages, okay? Let's start in bed. If you get up in the middle of the night, you have to go to the bathroom, or in the morning when you're getting up ready to start your day, it's best to get onto your side, lay there for a second, see what you feel, okay? Then come up sideways and just sit in the edge of the bed. Stay there again and see what you feel. If you're really uneasy, you're sort of spinning a bit, you're not steady, you sit and you wait till it passes, because most of the time it will. Now, if you've got a true case of vertigo going on, sometimes that room will stay spinning for a while, and laying down maybe your only bet. So that's a whole different story. This is for the ones who are not so severe. So we want to get up, we're going to sit there, we're going to sit until we feel stable. Okay? Then stand up, and again, see what you feel like. Don't just take off. Okay? Because I can recall the first time I really ever experienced this, I had to get up in the middle of the night to go to the bathroom, right? So I'd pop up out of bed, hop on the floor, and boom, go right off into the wall and stuff. Talk about waking up really quick, like whoa, and stuff. So that, my first experience. So go in stages. So once you're standing, then start to walk and go and take your time that way, okay? It's the same thing when you get up from sitting down. That changes in the blood pressure and the blood flow from a sitting to a standing position also can affect heart rate, your blood pressure, that kind of thing too, which also can contribute to a bit of dizziness also. So again, get up, stand there for a second, see how you're feeling, then go off and walk, okay? If you're having a lot of issues, carry a cane with you, okay? We don't want you falling. That's the main thing. You've got one problem going on, let's not have a fall, and then you make multiple problems happening that way too. So just make sure that you're doing these things, taking care of yourself, taking your time. Again, always make sure we're getting that upper neck checked, because that is so important in the neurology of your equilibrium, your inner ear, all that working together. So we want to make sure that is adjusted and taken care of that way. The Epley's maneuver is an exercise you can try. Honestly, I don't know if it's helped me a great deal. I've done it. And I do it at times if it bothers me, and I just put it in with my adjustments there. So I want to give something for you to do at home. That's why I'm going to keep it short and quick today. I want to wish you guys, like I say, have everybody a Merry Christmas. Remind everybody we're doing our DOT exams. So if you've got drivers who need help and they want an exam, we're here to help them. I wish you guys a Happy New Year. We're going to be taking a break probably till January before we do our next video because we got the holidays around the middle of the week, so we're going to be throwing things off whack for the next couple of weeks. But we'll pick back up in January, and I want to wish you guys a great day. Thank you very much for your time.